For this podcast, I will be discussing my available data web review. There certainly is no shortfall of HIV/AIDS data on the internet. I looked into government agencies, federal, state, and local, private organizations, and religious groups. We'll start off with the data I found from federal government agencies. I was able to get data from the CDC, AIDS.gov, and the Bureau of Justice Statistics. The CDC had tons of available data on their website. All the data they get is compiled from 40 states and 5 U.S. dependent areas, and they use confidential name-based HIV infection reporting. Most of the data that they had was HIV prevalence rates, incident estimates, diagnosis by age, race, ethnicity, transmission category, persons living with the disease, and persons who died from the disease. Tons and tons of data. If you want to look through it, a link can be found on my available data web review. We'll now move on to AIDS.gov. AIDS.gov is a website that's funded by the federal government. They compile data from various federal agencies such as the White House, the U.S. Department of Health and Human Services, and the United States Department of State. They provide facts and they also provide quantitative data on HIV/AIDS. Just to give you an idea of some of the facts they present are more than 1 million people are living with HIV in the United States, and African Americans face the most severe HIV burden. All of their facts and data can be seen on their website, and a lot of it is broken down into pie charts and graphs. The last group of data I received from the federal government was from the Bureau of Justice Statistics. The Bureau of Justice Statistics is part of the United States Department of Justice. They collect data on crime, offenders, victims, and justice systems from all levels of government. All this data is published and put on their website. Most of the data that they provide on HIV/AIDS is prevalence rates within the federal and state prisons. One important study that they had was for New York prisons during 1995 and 2008. This was very interesting because in slightly over a decade, they showed that the HIV/AIDS prevalent rate in New York prisons went from 9,500 people to 3,500 people. We'll now move on to state governments. I gathered data from 3 states, Florida, Illinois, and Pennsylvania. Started off with Florida. In Florida, the Bureau of HIV, AIDS, and Hepatitis within the Florida Department of Health publishes HIV/AIDS data for the state of Florida. One interesting document they had was published in 2009. It was titled the Florida HIV/AIDS 2009 Update. Had almost 83 pages. And within these 83 pages, there was 11 pages of just pure data. Most of the data they provide is prevalence rates, minority infections, and exposure types. They also had an interesting map in their study which showed Florida broken down into all of its counties and what the case rate was per 100,000 people in each county. Now on to Illinois. Most of the HIV/AIDS data from the state of Illinois is provided by the Department of Public Health. They provide data on statewide reported HIV/AIDS cases for the years 1995 to 2005, cases by county for the years 1981 to 2005, and statewide and county HIV/AIDS related deaths for the years 1990 to 2002. All the data they have is broken down by sex, age, ethnicity, and exposure type. And since 2005, they also started to publish a monthly AIDS, HIV, STD surveillance report. We'll now look at the last state I gathered data from, which is Pennsylvania. The state of Pennsylvania Department of Public Health publishes most of their HIV/AIDS data. They have an annual surveillance report, which they publish every December, which is on their website. These are available from 2005 on. The report consists of HIV/AIDS data categorized by county, age, sex, race, and mode of transmission. They didn't have too much information on their website, but they did have a little link for people seeking data that wasn't listed. They provided a data request form. Now to look at local governments, I looked at two local governments, the City of New York and the City of Los Angeles. The City of New York, most of their HIV/AIDS data is provided by the Department of Health and Mental Hygiene. According to the Department of Health and Mental Hygiene, New York City is the epicenter of HIV/AIDS in the United States. An interesting fact that they stated was that the AIDS case rate in New York City is 3 times higher than the United States average, and that HIV is the third leading cause of death for New Yorkers aged 35 to 54. Because of the problem the city is having with HIV/AIDS, they do a lot of research. Most of their research is published online through annual surveillance reports. And since the year 2001, they have published an in-depth data table and a small concentrated data table. The data table provides statistics categorized by age, race, borough, mode of transmission, and geographical area. And the condensed table provides the same exact statistics, just they eliminate boroughs and geographical areas. Now we'll look at the City of Los Angeles. In the City of Los Angeles, all their data was compiled by the AIDS Coordinator's Office, which is within the Los Angeles Department of Disability. The data they publish is similar to that of most other government agencies, race, sex, ethnicity, transmission type. They did provide an interesting study on AIDS diagnosis from 1991 to 92 and the year 2005, and they showed a dramatic rise of AIDS cases within minority communities and a drop within white communities. Now take a look at the data I was able to get from private organizations. The two that I was able to get data from was Ansel Limited and Trojan Brand Condoms. Ansel Limited is a company which owns the brand Lifestyles, and Lifestyles produces a very popular brand of condoms. They don't provide too much data, not as much as a government agency would, but they do provide some facts that are interesting. Some of the facts they provide are there are over 20,000 new cases of HIV/AIDS each year in the U.S., and that 75% of the new cases are from heterosexual acts. Now we'll look at Trojan Brand Condoms. Trojan Brand Condoms are the United States #1 selling condom brand. On their website, they published an interesting report called the 2010 Trojan Sexual Health Report Card. They ranked 141 schools based on things such as students' opinion of their health center, access to condoms, and access to HIV testing. They said the goal of this report was so that students could take their health into their own hands. The last group I compiled data from was religious organizations. I looked into two groups, the Orthodox Union and the Southern Baptist Convention. The Orthodox Union is a Jewish group proclaimed to be the world's largest Jewish resource. They created a website called nagia.org, which helps Jewish teens practice abstinence. To help them practice abstinence, they provide data on HIV, such as 20% of all AIDS cases are diagnosed in an individual's 20s, and that most people who contract HIV got it when they were teenagers. Now to look at the Southern Baptist Convention. The Ethics and Religious Liberty Commission of the Southern Baptist Convention published an article which contains some data. The article was entitled, "It Seems That HIV Really Is a Gay Disease." Not going to go too much into this article, but some of the data they provided was that 70% of the people living in the U.S. with HIV/AIDS are gay or bisexual, and they also stated that 66% of all new HIV/AIDS cases were contracted through male-to-male sexual contact. Some of the ideas that they expressed were a little controversial, but I guess it helps to get data from all sources, whether they are reliable or not. To conclude, there's numerous amounts of data available on HIV/AIDS on the internet. Some of it is extremely reliable, such as that from government agencies, and some of it not so much. But pretty much the main point of all this data is to show that HIV/AIDS is a pretty serious epidemic, and that we definitely need to